I think just the presentation of these solutions as like the only answer just limits people's questioning and thinking. It's like a pill for an ill and a conversation, and everyone's kind of been trained up in that. And rather than thinking, what are all the various contributing factors to how I feel the way I do, just that mindset of I'm looking for a single thing to fix it, and the option is a pill, I think is really disservice to everybody.
Welcome to Heal, a podcast about the real stories of what it takes to heal. I'm your host, Dr. Sarah Marshall, naturopathic physician, published author, and psychedelic integration guide. What does it really take to heal? We sit down for raw, authentic conversations from science to spirit, trauma to transformation. If you want to learn more, go to my website, sarahmarshallnd.com, and sign up for my newsletter, where I share my most cutting-edge new thinking, what I'm seeing right now in the research and in my clinical practice. So you're getting the most up-to-date information, practical tools in your inbox. Check us out, join us, and enjoy the show.
Dr. Tracy McCarthy, thank you so much for being here. I'm thrilled to have you on Heal and can't wait to hear more about your story and what brought you into functional medicine, and specifically really want to get into stuff around natural mood solution. I think that's an area that we just need to talk more and more about, supporting people around mood and emotions, and that it's more than just a pharmaceutical pill. We have
Yes.
those, they can be supportive, but we have a very broad range of other solutions and supportive things for people. So thank you for being here.
Yeah, my pleasure. Thank you for having me.
Awesome. Well, I'm going to just kind of cut to the chase and dive in. And then I trust as we go, anything that you want to share about your background or, things, the details of your own training, like feel free to pepper that in. But people will get to know you through this process here. I want to start there. Like, how do you see that the pharmaceutical approach has actually inhibited people from getting well? Like, what have you seen in your practice?
What a great question. I don't think actually I've ever been asked that. My issue with it is that it's all that people are usually offered. And so the thinking for so many patients is like, this is my menu of choices, is this pill or that pill. Maybe they're recommended to do therapy, which is great, but that's kind of it. And there's no discussion about what the biological causes of this could be, and also not enough conversation about what the psychological and emotional causes can be. And all of these things matter and they all interact. And so I think just the presentation of these solutions as like the only answer is just limits people's questioning and thinking. It's just sort of the model we're in, unfortunately, in conventional medicine. It's like a pill for an ill and a conversation, and everyone's kind of been trained up in that. And rather than thinking, what are all the various contributing factors to how I feel the way I do, and what are some of those root causes that could be unearthed? And there's a huge role for medicine and physicians in that, as well as the individual, in terms of helping people know that there are these different biological causes that ought to be checked out. And you can have multiple of these. So just that mindset of I'm looking for a single thing to fix it, and the option is a pill, I think is really a disservice to everybody.
Yeah, I often talk to my clients about specifically around mood, like anxiety or depression support or things along that we want to mostly think of the pharmaceuticals like a cast if you broke a leg. There's a time and a place when like an acute situation, going through a major relationship change, life change, when we're sort of in that state where to be able to take action on the other things that may support their healing is just inconceivable to even be able to mount the energy and the effort to do that. There may be, for a period of 3 months, 6 months, maybe even 12 months, a time period where those pharmaceuticals can be supportive. But what I run into my practice all the time is people get put on them and there's no discussion of an end point.
Yeah. And
Or
and as a
what they could do
psychiatrist,
to eventually be off of them.
yeah, and I have to say as a psychiatrist, I feel like that was even in my training, like not very often the conversation. And frankly, we were trained that if you have a recurrence of major depression or major depressive disorder, then you should stay on the medication for the rest of your life. Like that was my training. And it's just, there's just so much more to it. There's so much more that can be done. And I want to just be clear too, like I'm in favor of any kind of tool that's helpful. And medications
Yes.
can be helpful for certain people, for certain situations and certain lengths of time. But the idea that they're going to address a root cause is not true. And, they often come with side effects and they are limited in their efficacy. So we just have to have a broader conversation.
Great. Well, let's have that broader conversation.
Great.
So, you talked about root causes and you talked about some of the other contributing factors. What are some of the top line ones you see, like, say, particularly around depression?
Well, particularly with depression, we need to think about inflammation. And I'm sure your listeners and viewers have been hearing lots about inflammation because it is the common pathway to so many chronic symptoms. And it's really kind of how I got into this, was understanding the research behind inflammation and its role in these chronic symptoms and how that's really what's missing in our our model, really, our approach, is what drives that chronic inflammation and different factors in different people. And that's going to manifest differently in different people. And for some people, it's going to show up as depression. And we know that when people benefit from an SSRI medication like Prozac or Lexapro, there are certain inflammatory markers that go down when those responders are having some shift in inflammation. Inflammation is a huge part. And there's tons of studies, for example, on omega-3 fats in depression. That's like not disputed in any way. And those are anti-inflammatory. They're changing the signaling in the body and the signaling in the immune system. Inflammation is highly linked to depression. And then the trick is, what are the triggers in you who are, you, the person with depression, that is driving that inflammation, and identifying those and working with those, making lifestyle changes, nutrition changes, supplement changes, that are going to impact that.
Yeah, I remember seeing, particularly during COVID, more the first year when we had some of the really, really intense strains, and people would get through the cyclical fevers. A lot of their physical flu like symptoms would complete. And then they were often experiencing up to like 3 to 6 months of a darkness
Uh-huh,
that was
uh-huh.
like, at first was like, is this me? Is this the pandemic? Is it actually because we're all, shut in place? And it started to come out in the research, more and more understanding of interleukin 6, which is a cytokine that specifically spikes fever, but it also very much is related to inflammation and can contribute to this experience of kind of dark thoughts and a depressive episode after a viral infection.
Yeah, that's really true. And I bet a lot of people can look back and realize they've experienced some of that. They call it cytokine sickness. And it's sort of, some people speculate like evolutionarily, it's about sort of isolating yourself and not spreading the sickness. We don't know, but it's an interesting idea, that definitely people can feel. And I've certainly experienced this when I've gotten sick, and then I feel just I got cognitively, I can recognize this is ridiculous what I'm thinking, but I'm thinking like I'm never going to get better. It's just all so hopeless. And yet I'm like, I always get better from whatever little bug I get. Like, why is this what I'm thinking? But it really does that to your brain. And it is that those inflammatory cytokines, those interleukins, that really drive that.
Yeah, it's just I've always been in, like, my background in naturopathic school. I did a whole bunch of work in psychoneuroimmunology, which is the study of the interrelationship between our mind, our body, and our immune system, and then toss in hormones into that, and it's psychoneuroendocrinology, and we
Right.
start just
Yes. I
putting
was
all
going to
the
say endocrine.
the Latin words together, but basically is we are actually all connected. And our
Yes.
thoughts can be influenced by our gut, and our gut can be influenced by our thoughts, and like back and forth. And the extent to which that now we start to see the molecular reality of that, uh, it fascinates me. And also, my dad used to always say, yay, science proving what we've known with common sense all along. And so there's an element of like that too. So
That's
when we
right.
talk about decreasing inflammation and like contributing factors, what are some of the other sources of that inflammation that you see that people should be on the hunt for in kind
Well,
of a mood disorder situation?
I mean, the biggies are standard American diet. If people are, I have a feeling your audience is not eating the standard American diet as much, but maybe they're new to this. And so really cutting out the processed foods, reducing them a lot, and introducing whole foods, healthy fats, nutrient dense foods. That's critical because that's going to shift the needle right away. That's going to affect what bacteria are growing in your gut. And we know that microbiome has a huge impact on inflammation, interacting with your immune system all the time. So that's the first kind of most obvious one. And that's a big project. I mean, one doesn't change everything in one day, and you shouldn't. Baby step your way through through changes and make them easy, each one, before you move to the next. So it's sustainable. But the food is a huge thing. Toxins are another massive driver of this. One that I see all the time that I think people should be aware of and on the lookout for is a water damaged building, like living in a moldy home. I mean, I wish it wasn't so common. It is so common that people have had some kind of mold exposure and they are unaware. They don't smell it. They can't see it. They don't know that they're impacted. Other people in the family aren't feeling it, so it doesn't feel like how can it be in the home? But everybody's different with their detox pathways and their previous exposures. So you could be suffering from that and not realize it's driving your depression, your anxiety, your brain fog, and a host of other symptoms. So that's one to really, if you're not feeling well and you're doing the dietary interventions and lifestyle changes and you're not getting better or enough better, that should be high on the list of suspects. I mean, there are a lot of toxins that are contributing, but that's just a huge, big one that I see really, really impacting people's health.
Yeah. I see that relationship too of like getting off of the processed foods is yes, inflammation, but there's so many toxins in our foods that can be triggering for different people's physiology, depending on their genetics, depending on how well they clear certain things through the liver detoxification pathways. And, lately we've been talking a lot about like you know, unnatural dyes in foods, but really, like, there are so many things that got introduced simply to make a food look good, not having anything to do with nutritional content, just to make it appealing to us to eat and maybe not even taste any different. And those are contributing factors to
Yes.
particularly sensitive people that their body doesn't detoxify. And I find that those kind of go together is like for me myself as an emotionally sensitive person, I also tend to be more chemically sensitive and vice versa. And so that's like one of my kind of keynotes around that is I notice I'm just sensitive to like all
Yeah.
kinds of things.
Yeah, we have the patients that are canaries in the coal mine. Like I was saying, like a family is maybe not ill, but there is one person who's really struggling, and that's that person who is more sensitive and has, the genetics that make it tougher to detoxify in our world that has a lot of toxins now.
Yeah. So inflammation is a huge driving factor. The toxicity, particularly one that I think more people are talking about. We've done some shows on mold illnesses, but like it's just more and more needs to be kind of a run of the mill conversation and not such a like, oh, this random,
Yeah,
maybe you have mold. I feel like
yeah,
it's
I think
just
that's really
needs to
true.
be part of things.
Yeah, that's been a real learning edge for me as a practitioner to not try to wait until I've tried to fix everything else to be like, I guess maybe it's mold. It's like what I've really learned over time is we need to screen for it right away and address that because if we don't, all this other stuff is never going to get us very far, and you're going to spend all this energy and time and money trying to get well, and so where this big roadblock is there that we have to address. So I agree with you. It has to be just much more of a common conversation. It's just not rare. That's just how it is. Yeah,
Yeah,
I wish.
absolutely.
It's
Yeah, I
but it
know.
is
Yeah.
people need to know it's treatable. It's very treatable.
Yeah. And especially like I think there's sort of some horror stories out there of people who are particularly like resistant to the detox pathways, but that I've had clients where it was just a layer. It was a
Yes.
layer in what they were dealing with and it was like 3 to 6 months to do some specific clearing around it and I mean you could probably talk more about this, but like what I learned was how mold paralyzes the rest of the immune system. So the other parts of the immune system can't rally to do their job when the mold is there. So it's sort of like until we get that guy out it's hard, like you said, to do the other job.
Yes, 100%. That is exactly the case. It affects the immune system. It also affects the detox pathways. So it's like you have to deal with that so that everything else can start working. And then it's amazing what your body can fight off and manage once you get that out of the way. That's really true.
Yeah. What are some of the other contributing factors that you see? Maybe we shift the conversation a little bit more towards anxiety as well, or including some of that.
Well, I would say one more thing about, I mean, this is true for anxiety as well as depression, but, we were talking about inflammation and we were talking about nutrition around inflammation. But there's the other piece of nutrition, which is actually making sure you have the building blocks you need for neurons to function and for detox pathways to function. I mean, just the raw materials. So it's getting the inflammatory foods out, but it's putting in the building blocks like the B vitamins, the zinc, the like I mentioned, the omega-3 fats, and the good fats in general. So you need these components or, it's like you've got to have hardware that works, basically. If you're trying to go to therapy and change the software, great. It's very important. But, if the neurons can't fire right, they don't have what they need, then it's going to be a real uphill battle. So I think that's the other piece of nutrition to think about is like really feeding the brain, feeding the nervous system. So with anxiety, there is a really interesting piece that's diet related, I find, and that is blood sugar. This can affect depression as well. Like running around with high blood sugar all the time can increase depression. It's well known to be the case in diabetics that uncontrolled blood sugar causes more depression. But of course, I'm seeing people all the time who don't yet have diabetes, but they're somewhere on that spectrum of insulin resistance and their bodies aren't managing their blood sugar well. And they often have no idea this is going on. And that can be because they go to their doctor and their hemoglobin A1C is normal. And so that's the end of the conversation. But no one's looked at a fasting insulin or done a continuous glucose monitor or really even a careful history. So what I see is that a lot of people are riding the blood sugar roller coaster. They're up and down all day and in the night. And this is a very common overlooked cause of waking up at 1 a.m., 2 a.m., 3 a.m., being awake for an hour, just very alert, maybe anxious, maybe just alert. And can be because the blood sugar just plummeted right before that. And then your body releases adrenaline or epinephrine to rescue that blood sugar. So the sensation in your body is getting very alert and possibly anxious. And you can make some very easy adjustments to what you're eating at dinner or even a snack before bed that can change that overnight blood sugar pattern and change that waking up. And we see that in the day too with, anxiety sort of attacks happening when the blood sugar crashes. And then again, the adrenaline's released. All this is happening, you don't even realize it because your lunch was like higher carb and you had to release a lot of insulin to deal with it. And then it kind of overshot because you have insulin resistance. And so then the blood sugar goes too low and then you release the adrenaline and you're on this sort of roller coaster. You eat more carbs to fix it, and then up and down you go. So that's a
You
very
throw in
common
some
cause.
caffeine and some
Yeah, right.
extra stimulants in order to get through the crashes and yeah, exactly.
That is to me the like low hanging fruit, like across the nation. It's like if we could stabilize blood sugar, a whole lot of things would get better. Like a lot of things.
Yeah, I see it related to adrenal dysfunction, which also is part of that adrenaline cycling. Yeah, many, many, many times when people come in when one of their primary things is overwhelm or stress or anxiety, that's like the first thing we've got to work on. And then I'm sure you find this too is also hydration.
Mm,
Like,
yeah.
just drinking a sufficient amount of water brings a certain level of calmness to the body that we don't even always realize. I don't always realize that. So, how often I get this just edgy feeling a little off. Also, when there's my next question is going to be about brain fog and memory. And that's one of those where, I don't find that I solve brain fog and memory issues with water, but it does help. It
Well,
actually
it's
is like just getting that hydration in.
what I would call it is like necessary, but not sufficient. It's like you have to do that piece of it. And that might not be enough to resolve it all, but it's a necessary foundational piece. Absolutely. And it makes sense, right? What a stressor on the body if you're kind of chronically, uh, you know, low on water. That's, if you're dehydrated, it's not going to work. So,
So then shifting a little bit into the other biggies that I hear so commonly from people, and it's like, I don't know how much it's like cart and the horse and the horse and the cart, but a lot of people have even said, particularly since 2020, they've noticed an increase in brain fog, difficulty finding words, just this I go to think, I used to know the name of that book, I used to know the name of that thing, and I just can't quite grasp and pull that out of my memory anymore, that word loss. That symptom alone, I have heard so frequently, and I did not hear it hardly ever in the first 12 years of my practice. And I know there's a lot of factors of just even the stress of going through the pandemic, but what have you seen around brain fog and memory issues for people these last 5 years?
yeah, I agree that they're huge. I think part of it too is people really feeling they can talk about that as well. Like it is more like brain fog is an actual symptom. People have heard it. They feel like they can recognize when they have it. But yeah, I think that there's a lot of pieces, right? As you mentioned, we've talked about the toxin piece, the blood sugar piece. Those can be contributors for sure. Then just the chronic inflammation. Hormones are huge for this, huge. and also the vascular piece. And I think that's where, COVID especially has an impact is what's going on with that blood brain barrier, and is it intact? And, for so many people, it's not functioning well, just like their gut barrier is not functioning well. It's sort of a barrier issue. And, mentor of mine, Dr. Christine Burke, who's one of the researchers in Dr. Dale Bredesen's Reversing Cognitive Decline program studies, she really talks about this sort of unified barrier hypothesis. And I think it makes so much sense. And there's all these things impacting how well that vascular system is working in the brain and how permeable it becomes. There's all these ways it's supposed to repel toxins and keep things out and help clean, the brain, right? And that's breaking down. And I think that the COVID component has accelerated that. It's not the only virus that's at play a lot in folks like this. And we know also COVID will reactivate Epstein-Barr and other viruses. So we'll see those impacted. But it's usually a soup of things like mold, inadequate hormonal support, which is what we would call a trophic factor, like a growth factor for neurons. So if they're missing that, that's a problem. If they're missing other trophic factors like vitamin D, B vitamins, and then if they have other things that are blocking, like toxins, metals, chronic infection, um, things like high homocysteine, these different inflammatory markers that's all going to create an environment that is unhospitable to neurons, and they're not going to stay connected to each other, they're not going to function well. I mean, brain fog really is like the very, very, very early cognitive decline. It's that
Hmm.
it becomes subjective cognitive impairment at some point if it progresses, and then, then eventually can be mild cognitive impairment. So it's actually a really important symptom to pay attention to and to find the root causes for and reverse, because it's much easier to reverse that early on before it gets more advanced, before there's more damage.
That's fascinating. And like I knew pieces of that, but reconnecting, I even in my circles, I don't think we're talking enough about the vascular piece and the blood brain barrier. Like I go to conferences and it comes up here and there, but it hasn't been as much spoken about is like leaky brain
Yeah,
is how
it's
one of
big.
my professors actually talked about it.
Mhm. Yeah, I think that's really at the core of what's going on, why the brain is so impacted. Because, if the brain is leaky, just like we talk about with the gut, where you have antigens, you have things crossing into the blood from the gut that shouldn't be there, right? Whether it's an undigested protein like gluten, or it's a bacterial component like LPS, or it's a toxin. All of these things are triggering the immune system that's there patrolling the gut, from the bloodstream right there out around the gut, and that's driving up inflammation. Well, you're going to have the same kind of thing happening if you have things crossing from the blood into the brain. You have these microglial cells that are the immune protecting cells in the brain around the neurons, and they're going to get activated. You have microglial activation, and that directly drives brain fog. So it's that immune activation happening in the brain.
Interesting. This is like I'm gonna pull this out of nowhere and you can just tell me. But one of the things that has come up, I've gotten questions about is glutamine and glutamine as food for the brain. But like I'm always questioning how reasonable is it for us to just eat an amino acid and expect that it's gonna get to the site that we want it to. So do you prescribe that? What do you see around glutamine and being able to support brain function as like brain food?
Yeah, that's a great question. There are practitioners who are very focused on brain health and brain symptoms that do use a lot of amino acids. Like um, they might use it for focus or use just a very targeted sort of approach with amino acids. That's never been my approach. It wasn't really my training with like Institute for Functional Medicine, and not even in my additional training after that, not a huge focus. There are ones I use very targeted, like, probably like you do as well, like L-theanine, for example. We know how great that is for relaxation, anxiety, and it's sort of a adaptogenic. Um, but yeah, I think I tend to take a more of approach of like, if we're really not breaking down protein well, obviously we're going to support digestion, but there may be a role for more branched chain amino acids, or more amino acid blend, in a person for a while as a bridge. Um, so, I take a part of the general approach. I don't usually use a lot of targeted amino acids.
You and I are in agreement there. trying to always not lead the witness, but like it has come up and people ask me, and I've heard glutamine for focus also has come up. And I mean, for me, when my clients come to me with some of those things, I'll give them my sense and I'm like, look, if you want to try it, like, see
That's me
what
too.
difference there are people where it's kind of amazing actually how like that started to fill a niche for them that they weren't able to get filled otherwise. But then I always go back to, if you're eating enough grams of protein and you have a diverse diet, then what are we doing with breaking those foods down and absorbing those foods in your body to be able to actually get them where they need to go overall? But I mean, I'm curious actually before I go into it is I have used amino acids in support of tapering off of pharmaceuticals when people are at work in that transition in order to give them support. And curious kind of how you go about working with people if someone is ready to consider reducing a dose or changing their pharmaceuticals that they're on.
Yeah, well, I think it's very personalized. And I think what I tell all my patients who come in on a medication whose goal is to come off of it, if they're tolerating it okay, then I don't encourage them to stop it yet. I really want to work on changing the terrain, really helping with the nutrient deficiencies, reducing the toxic burden, driving down that inflammation so that they have a brain that's adaptable, so that we've increased the neuroplasticity because their brain is adapted to that medication at this point. And so when we taper it, it's going to have to adjust and change, and we want that to go smoothly. And that usually involves you know, some work for a while, including making sure fundamental things are in place like magnesium and omega 3s. And then it's really, I just am about going slowly and what feels good to the patient. I think their intuition around this is usually very, very helpful because some people can come off things much more rapidly than other people. And I think if you believe that it's going to be too big of a drop in dose, you will have a reaction. It's like their brain is right what we think, and whether that's because they know it already intuitively or just they're fearing it. And so that creates that reaction. It's important. So we have to respect that and pay attention to it. Um, so and then I use some additional tools in my practice, like I actually do some bioenergetic testing that really helps me tailor what I'm doing to that individual. So I don't so much have one protocol, but the goal is why did they get in that situation in the first place? Let's address that. And then the need for the medication sort of dissolves and they're adaptable. They have neuroplasticity. They can come off it.
Yeah. Yeah, I'm not a fan of ripping off Band-Aids. I like to bring their level
Yeah.
of health up to a certain point where then it sort of just like naturally. I've even had clients where we didn't touch the medication, we just worked on their health and they started actually having increased side effects from the medication because their body so didn't need it.
That's
And
right.
and so then that was our clue, is like you're really your system is like, I don't need this much anymore. It's like too much for my system. And then we would start tapering based
Yeah.
on a really interesting feedback there. Yeah,
Yeah,
absolutely.
no, exactly. I mean, there certainly are cases where someone comes to me and they're having a lot of side effects and it's like it's not even good med management that I'm seeing, from that they come. So I will adjust those kind of things. But for anything that's being tolerated, I like to take a slower approach and work on those root causes.
Absolutely. Yeah, that's great. And you mentioned kind of bringing in allowing their intuition to guide your process and your own work with bioenergetic work. That's a big area that we've talked a lot about on Heal is allowing this to be a collaborative experience of working with practitioners. And so I'm curious for you about, just what you have to say of the role of intuition in medicine.
I could talk for a
Just a
long time
giant
about this.
question, but I just thought I'd
Yeah,
throw that
well,
out there.
first of all, about collaboration, I think that's critical. And
Hmm.
every study on the therapeutic alliance shows that it's more important than anything, right? We knew that was something in my training in psychiatry that was really made clear. Like your relationship with the patient is like the most important piece, no matter what you're doing. But way beyond that, it's I'm in the opposite of this sort of patriarchal medical approach doing what I do now, and I love it. It's like my patients they're in charge of their health. That's like a boundary issue actually. Like I'm not fixing them, they have to do that themselves. I have to, it's been a process to remember that and not also take it all on because that's how people burn out, like thinking I have to fix everything. It's like, well, I can't. I'm just one person and I don't know all the pieces of their puzzle. It's their health journey. I'm here to advise, bring my best ideas and my best support, but it's in their hands. Um, what's so wonderful is when you're in that collaborative relationship with patients, they teach you so much. And I'm always learning from my patients, and I have smart patients. Like you were telling me before we started about your smart, educated audience, right? Like I love that. They bring me really interesting, challenging thoughts and questions, and it just makes for a better outcome that then has a ripple effect to other patients. It's like that's how you become a better and better practitioner is really listening and learning from your patients. So I love that a lot. And then about intuition, I just think I did not come from a place of even using that word, I would say, originally. A very conventionally trained medical doctor. Before I went to medicine, I was a engineer, and I was, just very um, conventional background. And it was only through learning about the process of the information about chronic inflammation and sort of having my eyes open that all this stuff was not taught in medical school that is really impactful. Like I learned a lot of great stuff there, but there was a lot missing. And the nutrition, all of it was just there was so much that was overlooked, and realizing that wow, people can get better from like autoimmune disease and stuff by changing their nutrition. And it's not that simple in every case, of course, but there's some really amazing stories out there. None of that was ever presented in my education. So I kind of had the scales fall from my eyes. I got open-minded. I ended up diving deep into this, finding out about functional medicine, going down the rabbit hole, getting trained, really changing my whole trajectory. And thank God, because through this process, it's been so eye-opening, and it's been such a personal journey of being more and more open and seeing more and more things that are really amazing because of that. Through that process, I've really realized how much intuition is important, how we are getting information all the time if we can listen to it. And the patient is, I am, and we can use that. And so it's becoming an increasingly important part of the work we do. And obviously, it's totally informed by the latest science and everything. These go together is the point. So yeah,
Yeah, I
it's
completely
important.
agree. Is like it's not about one or the other, but the letting there be that dance. And the more we do learn I've been studying a lot of polyvagal work and in mirror neurons and the way we co-regulate each other. There's so much actual really hardcore scientific pieces to what we're picking up on from each other that we just haven't quite built all of the subtle technology to be able to measure all of it, but it doesn't mean that it's invalid. And yeah, there's a lot of reproducibility to it, which is one of the keynotes of science, is that things can be reproduced and consistent. And so yeah, I love that. And I also feel that my job, I do bring a lot of information forward, especially at the beginning. The way I used to say it is I'm like 80% doctor and 20% coach. And then over time, I become 20% doctor and 80% coach. Now I would even kind of expand the word coach to guide. Like I'm not even really coaching,
Teacher.
just guiding, teaching.
Yeah. Yeah.
Exactly. And
Most original
asking the
root.
questions that I may not even have the answers to, but for them to inquire into and where that takes them.
Yeah. Well, the real original meaning of the word doctor is teacher, to teach. And I think that that's truly what we do when we use this holistic, view. It is helping people learn about their bodies and be empowered to heal themselves and to do the things that are going to bring them and move them forward in their health journey.
Absolutely. Yeah. So as we start to kind of bring it together, how would you define healing? What does it mean to heal?
I mean, that's a wonderful question. I think, what comes to mind for me is much, much less of a physiologic notion, but much more of a emotional, psychological, sort of energetic place of peace and faith in the body, and feeling that you can, to me, it's knowing how to listen to your body and respond to it and be resourceful and give it what it needs, because it's not like you arrive at some place and you're done. You're journeying through life, and there's always new things like
That'd
a
be great,
pandemic
but
or
no.
yeah, right. Or like menopause, or things are happening, right? So it's a dynamic situation. So I think it's to me it's a mental state, or like an energetic state of being um confident that you can listen and respond and have resources and be okay.
Yeah, beautiful. Absolutely. And so, as people want to learn more or take this deeper for themselves, you've created an online program to support people around this. Can you talk more about what that is?
Yeah, certainly. So, with working for, a decade with patients in this capacity and you see the common themes, right? And what's frustrated me is that there's no conversation happening in their primary care doctor's office or in their psychiatrist's office about what else can be done. Like we started off the conversation with, right? It's really like here's the medication options and maybe therapy and that's the end of conversation. And there's just these basics that should be checked. And I feel like if most people could try those things and make some lifestyle changes, some nutrition changes, so many of them could have big improvements and not ever even need to see someone like me, or maybe they get a lot of it fixed and now there's just that last bit that they want to work on. The foundational stuff can be taught. And so that's why I created the Natural Mood Solution online course, because it's really about these different areas: blood sugar, nutrition, gut health, like these foundational pieces, and just to teach and empower and say, this is just work on these baby steps, baby step your way into kind of a different lifestyle, see how you're feeling, like you're going to feel the changes and be empowered, and then if you want to go deeper after that, no problem. But I think it's, to me, is I created it to fill a gap that I saw.
Yeah, I think that gap is still pretty wide. So thank you for doing
Unfortunately.
that. Yeah, I mean, there is more conversation about it, but there are, I think there's yeah, there's just a lot there. And I know there's a lot of moving parts for people. I mean, I love how open the conversations have gotten to be around trauma and around recognizing the role of trauma in our nervous systems, and much more conversation about the vagus nerve and its whole interactions between, I'm also looking now on the other side of these physical conditions of high blood pressure and cholesterol issues and heart disease and diabetes, and bringing more of the emotional conversations to that of like, do you experience anxiety and how does depression show up and how is that related? Both sides starting to bring it all back together.
Very
But
important. Very, very important.
there's, yeah, still a lot of territory to cover. And for each of my clients, I also really recommend them, like you said, trusting themselves and their intuition is sometimes I need to give my mental space a break and not try and think. I'm an overthinker. I will go and go and go and think and think and think and think and think and try and work the mental side so much that sometimes what I need to do is just go for a walk and eat good food. Like, just like get grounded in the physical and then balance that as well. And then sometimes I've seen amazing things happen where people do therapy or they make some shifts around trauma and physical symptoms disappear that they've been carrying
Yes.
for 30
Well,
years.
and you know why that is. I mean, when we understand polyvagal theory, right, and like what's going on with the vagus controlling everything in the gut and the organs, and if we can't even do cellular detoxification when we're in fight or flight, like how can anything really repair unless we're shifting that aspect? So it makes so much sense, and it has to be attended to. We have to take that whole person approach, right? Work on the trauma, work on the emotional pieces, work on the nervous system regulation, and not poison ourselves and give ourselves the things we need. Like these go together. So yeah, I think it's critically important.
Yeah. And I didn't actually ask you the specifics of how did you end up here in functional medicine personally? Like, you were, a background as an engineer, then went into medicine as a psychiatrist, and then took that leap of faith into functional medicine. What was that like for you? What were the instigating factors for you?
Well, it really was around sort of the end of my medical school training and early residency where I was learning about things like low carb diet from just family experience and being like, this makes a lot of sense. If you're insulin resistant, why would you eat tons of carbs? Gee, if you regulate your insulin, it was like, this is just common sense. Why wasn't this ever discussed? Why is it just in medicine like, well, we're just going to give you more insulin if you eat more carbs? Like that's the end of the conversation. And I couldn't, I couldn't unsee that. And then I started to, as I mentioned, learn more about the role of chronic inflammation and getting this was sort of in the era of like the paleo movement was really new, and hearing stories about ulcerative colitis going into remission or other really dramatic reversals of autoimmunity, that to me was huge because, I just remember being in medical school, learning about serious autoimmune disease. I had a classmate with lupus, I had a classmate with Crohn's, and just, knowing that it was really hard for them, and the drugs are intense, and there was just like no other discussion of other things that might help. Seeing what was possible, to me, it felt like a crime that people aren't being given this information. I actually got really mad about it all for a while. It was very disillusioning for me. I was super naive when I went to med school. I felt like I'm going to learn everything I need to know about helping people. And of course, nobody has the corner on the market of all information and
Even the
knowledge.
naturopaths don't,
No,
because I thought I
nobody
was going
does.
to the Hogwarts of medicine. I was
Yeah.
like, this is definitely it. And then I was like, wait, still even here, there was
Yeah.
a lot of conventional thinking, even in naturopathic school of towing the status quo, staying with the standard of care in certain aspects. There was a way more pharmaceutical recommendations in naturopathic school than I ever thought there would be. I was shocked.
Interesting. Yeah.
And so then even I came out of that going, all right, I got to keep learning because it
Well, and
didn't
I
all
think
come
that's the
through here
lesson. Yeah, that's the lesson, right? It's like it's actually going to
for all
be
of
you're going to
us.
keep learning from all kind, and every kind of school has their different contribution to make, and it's useful to gain those. And so really it was like opening Pandora's box. I couldn't shut it. I couldn't look away from what I was starting to learn, and I couldn't ultimately, as first I just changed things in my own life, and I was like, "Oh, I have better energy. My gut feels better. I'm not like having to unfasten my jeans after dinner. Like I'm not bloated." And just noticing, feeling a lot better. I wasn't struggling with a major health issue, but I just was like, "This is important." And then um, I just eventually felt like I really wanted to do the training. So I ended up going to the Institute for Functional Medicine and starting that and really feeling like, oh,
Program.
these are my people, I feel like so aligned here. And then there was this misalignment with my day-to-day work. And it felt like a soul issue for me. I had to be doing what I was knowing to be true. And, I had been an inpatient psychiatrist at that point, working in the hospital, which is super important. You talked about the roles for medication, and, I was working with acutely psychotic people who needed stabilization. And so, it's a clear role for antipsychotics. However, I couldn't influence any of the other factors that I know matter, like what they're eating there. And there's really cool research on this from before the antipsychotics were developed about fasting and different things that can be helpful for stabilizing psychosis. And
Hydrotherapy.
yeah, there's just no conversation about any of
Yeah.
it. So I really, I had to begin to practice in a way that aligned with what I knew to be true. And so I had to open a private practice and learn that, learn how to run a practice and learn how to work with people in these areas. But it's been so gratifying just watching them, more and more dramatic outcomes as people are able to utilize these different approaches and make the changes in their microbiome and their lifestyle and everything. So that was really the process. I couldn't continue to work in a way that didn't um, incorporate what I had learned. And I still just feel like people have a right to know that there's more information. And that's really where that course comes from. The natural mood solution is really about like, you have a right to know that there's like a lot of things that contribute to this, and you can do a lot about it, is the good news. So I
Yeah,
just
it's
feel
really
really strongly
empowering.
about that.
Great. Yeah. I've taken the informed consent conversation pretty far, and I'm like, I really believe that we do not create a full and complete informed consent conversation in conventional medicine. And like, we got taught that you've got to go through making sure that you share the procedure and what the recommendations are and any alternatives and answer any questions. And I'm like, yeah, but you guys aren't presenting the real alternatives.
They
Like that
don't
there's
know them.
there's whole other ways of going about this. Social media has been interesting because there is so much more information. I get a little bit challenged by like, just because somebody healed their gut, they're now the expert on gut health. Although some of that information can be really good, and some of it gives me an opportunity to teach and educate
Yeah,
about,
it's a mixed
you
bag
know.
for sure.
But
Yeah,
it's
but I
but
give
it's way more talked about.
yeah, and I think it's good because from the point of view that it gives people, um, it's validating for patients to see someone else is struggling with something they have. I think so much of chronic illness is very isolating. So that's one area where I think social media is helpful. And then if it helps them start thinking about things and asking questions, that's good. But yeah, that it's often like this supplement is the cure for everything. It's like, well, it may help that person, but is it the right thing for you? Like, that's a totally
Yeah,
different question.
absolutely. Great. Well, Tracy, thank you so much for taking your time today and contributing here. We'll continue to put the word out. And I love that you created a program for people to get access to that where, they don't always have to go all the way to a practitioner like you and I can provide a lot of support. And there's a lot that people can do just getting the information and the education on their own. And like you said, having them have that empowerment. So there's lots of ways to go about it. And thank you for being one of the leaders out there making it happen.
Well, you're welcome. I feel like it's my privilege to do this kind of work. It's very rewarding.
Great. Well, until we get to meet again, thanks for joining the Heal audience.
Thank you so much for having me. It's really been my pleasure.
Thank you for being here. This conversation is your invitation to remember that healing can be messy, hard work, and also beautiful. Stay connected. Join my newsletter at sarahmarshallnd.com or through the link in the show notes. Until next time, keep asking the questions that matter, and you will find your own path to healing. And of course, a special thanks to my extraordinary and generous guests, my producer, Joshua Watherston, video editing by Nellie Dawson, artistic graphical design by Amy Pruitt, and music by Roddy Nikpour. And as always, thank you for being here.